Hey, it's Adam Sewell, MD. If you run a cash pay or concierge clinic, you already know most electronic medical record systems were built for insurance warfare, not patient care. Today I'm cutting through the noise. In the next 10 minutes, you'll see a straight cost for value comparison of 5 EMRs that actually work for cash pay medicine in 2025. By the end, you'll know which platform fits your budget and your workflow and what each one will really cost month to month. Before we dive into prices, here's the yardstick I'm using. True monthly cost after setup fees, add-ons, and usage caps. Cash pay friendliness, built-in Stripe or Square, super bill export, no forced claim scrubbing. Charting speed, customizable templates, macros, or voice dictation. Patient experience, mobile portal, telehealth, easy online payments. Compliance and portability, HIPAA, servers in the United States, API or export tools. Hold those 5 points in mind as we line up the contenders. 1. SimplePractice. Price. The Essential Plan is $79 per clinician per month for solos. Group practices pay about $74 per clinician when you add a second provider. Notables: clean mobile app, baked-in telehealth, instant Stripe checkout links. Hidden costs: $20 annual fee per clinician for AMA CPT code access, extra for insurance claim filing, which cash pay clinics can skip. Best for solo or mental health heavy practices that want fast scheduling and auto pay without heavy billing modules. 2. CharmHealth. Price: $0.50 per encounter with a $25 monthly minimum on the encounter plan. A flat provider plan is available, but starts climbing once you pass roughly 300 encounters a month. Notables: modular, pay only for what you use. Includes in-house e-prescribe and a surprisingly good inventory tracker. Hidden costs: paid patient portal texting and pay-as-you-go fax fees. Best for lean startups that see fewer than 300 visits monthly and want cost to scale with volume. 3. Kareo, now marketed under Tebra. Price: packages land between $150 and $300 per provider per month, depending on whether you add their billing and marketing bundles. Notables: mature billing engine if you ever decide to sprinkle in out-of-network claims. Integrated reputation management suite. Hidden costs: mandatory 2-day onboarding course and data migration fees if you're coming from legacy software. Best for clinics splitting revenue, some cash, some insurance, who need tight billing plus consumer-style online booking. 4. DrChrono. Price: standard EHR license runs $199 per provider per month. Notables: iPad-first interface, native voice dictation, and Apple HealthKit sync for remote monitoring. Hidden costs: $0.05 per outbound text, $0.07 per faxed page so heavy messaging can sting. Best for mobile clinicians, think house call, travel procedure, or athletic event practices who chart on the go. 5. Elation Health. Price: $349 to $399 per provider per month, all in. Notables: clinical first design, minimal clicks to document a visit, strong longitudinal chart, and one of the fastest e-prescribed flows out there. Hidden costs: none obvious, pricing is all-inclusive, but they do require an annual contract. Best for established concierge or direct primary care clinics that value deep chart continuity and want everything under one roof. Let's benchmark a one-provider clinic seeing 400 cash visits a month. EMR, SimplePractice, monthly subscription, $79, add-on or usage fees, Stripe 2.9% plus 30 cents per charge, approximate total cost, approximately $120, EMR, CharmHealth, monthly subscription, 400 multiplied by $0.5 equals $200, add-on or usage fees, messaging and fax, approximately $25, approximate total cost, approximately $225, EMR, Kareo, Tebra, monthly subscription, $225 mid-tier, add-on or usage fees, minor clearinghouse fees, approximate total cost, approximately $240, EMR, DrChrono, monthly subscription, $199, add-on or usage fees, text, fax, estimated $30, approximate total cost, approximately $229, EMR, Elation Health, monthly subscription, $349 and up. Add-on or usage fees, none, approximate total cost, approximately $349. If you add a second provider, multiply subscription columns, but remember that CharmHealth's per encounter plan doesn't double. It just tracks visit volume. Shoestring startup? Pick CharmHealth until you blast past 300 visits a month, then reevaluate. Mobile or procedure heavy? DrChrono wins for iPad speed and dictation. Hybrid billing? Kareo Tebra keeps claims and cash in the same ledger. High-touch concierge? Bite the bullet and take Elation Health. The extra charting efficiency pays back in saved minutes. Solo mental health or coaching style practice? SimplePractice is still the friction-free champ. Whichever way you go, lock in annual pricing before Q4 when vendors historically raise rates for the new calendar year. If you found this helpful, hit subscribe and drop a comment with the EMR you're using. Real-world feedback helps everyone. Check the description for a free one-page cheat sheet on these numbers, plus my personal onboarding checklist. I'm Sewell, MD. Thanks for watching, and I'll see you in the next training.